Hi, I'm Dr. Marc Sklar, the Fertility Expert, and welcome back to Fertility TV. In this episode, we're going to be talking about how to finance your fertility treatments and possibly IVF. So stay tuned for more information. Dr. Marc Sklar, the Fertility Expert, and I work with couples from all over the world and here locally in San Diego through my online programs and my one-on-one private programs. Oftentimes, a question that we end up discussing is finances. You know, as we're dealing with fertility, finances often come up, not just for what they need to do with their overall finances to be stable, but how do you work with fertility treatments with your finances, because some of them can be expensive. So here are my thoughts on it. First and foremost, I think it's important to get the biggest bang for your buck, especially up front. So I think the least costly with the biggest upside and increased and most efficacy is natural treatments. They're for sure not near, they don't have any near the cost of IUI or IVF. Especially if you start doing IVF with like donor or surrogacy or something like that, they're definitely nowhere in the ballpark of that. They're a fraction of that cost. Plus, they're going to make huge impacts to your overall health. And so this can have profound effects not just on your fertility health, but your overall health in every area and every system. So I think this gives you the best, most encompassing place to start, and hopefully that's the only place you have to go. So my first option is to start with natural treatments, and that's really not just because that's my preference in terms of natural treatments, but because I do believe that for most patients that's going to get you the most effect and the least cost. Two, once we start to get into number two, we're really looking at, do we do IVF or do we do IUI? Well, there's no real right answer. I think as long as there's no physical blockages or obstructions or real reason that says you have to do IVF, then I always prefer that patients start with IUI in some way. And the reason why some way, because there's variations of IUI, you know, with medication, without, and so on. So I think starting with IUI is very, very helpful, and hopefully that's where you'll be successful before going to IVF. Plus, it's also much less expensive than going through IVF. If you do have to go through IVF, then a benefit of doing IUI first is that you can see how your body is going to respond to the medication, even though it's not exactly the same, prior to going in and doing IVF. And the reason for doing that is, look, we don't know, even though they say that this specific protocol is going to be ideal for you in an IVF cycle, they don't know that for sure. They're basing it off of your hormone levels, your height, and your weight, and they're making assumptions. Many patients don't respond well the first cycle that they go through IVF because the doctors are just learning about their bodies and how they're going to respond. So it'd be a shame to kind of use one IVF as like a trial and test run when it's so expensive, and you could possibly do that with an IUI cycle. Again, it's not quite the same, but I do see some benefits to doing that. So let's say you've tried one, you've tried IUI, you tried naturally, you tried IUIs, and now the only option available, or you as a couple have made the decision that IVF is the path for you to go, then three things for you to consider. One is, many offices offer a guarantee program that you pay in advance a little bit more, but they're guaranteeing that you'll have a pregnancy or a baby at the end of the process, and if you don't, then they refund a portion or all of the money. Now, you do have to qualify for that, and not everybody qualifies, but I think it's worth looking into. Number two is oftentimes patients are taking out loans from a bank with high interest rates. My preference is, and we all get these in the mail all the time, if you can manage them properly, we all get these 0% interest credit card offers. It's not a bad option to finance part or all of your IVF through 0% credit card offers, as long as you manage that properly. And that's an if. I'm not your accountant, your bookkeeper. You have to look at that for yourself. But I do think it's a viable option. And then number three, I don't believe that patients should go bankrupt to have children and start a family. Having children having a family is expensive in and of itself. There's no right time to do it. You're never going to be fully prepared. There's no such thing. But I also don't believe that you should be bankrupt and trying to have kids, because it's a difficult process to manage in and of itself. So those are my thoughts on financing fertility treatments and how to manage that. Additionally, if you want more help to help you get pregnant naturally and increase your chances all on your own at home, then check out my fertility school. It might be the right thing for you. You can do that right here. Until next time.